A lot of people just assume it is just a rash. They're given a topical therapy by a primary care physician. Psoriasis is a chronic autoimmune inflammatory disease that affects not only the skin but also the joints. There's multiple genes involved, and which could lead to multiple different manifestations, including just a traditional rash, all the way to completely red and having tremendous amount of joint involvement. People think that when they have psoriasis that it's something that they did, or something that was done wrongly, or something that was done incorrectly, which is completely false. It's a genetic disease. There's nothing they can do about it. So if you have a rash, it would really behoove somebody to ask everybody in the family to see who else has had this. We're learning more and more that patients with at least moderate to severe psoriasis have concomitant risk, not only for arthritis, but also for cardiovascular disease, depression, diabetes, and even obesity. There is so many resources out there for psoriatic patients. Places like the National Psoriasis Foundation, and some of even the local centers, and even including the dermatologic societies. Diagnosis is usually done clinically. Clinically means by observation of a practitioner, usually a dermatologist. And it has a telltale type characteristic rash. And then there's some certain questions and in certain locations where the rash likes to exist, and that's what helps pinpoint the diagnosis. For mild patients, mainly topical, simple cortisones really do a great job, and just simple skincare regimens that we would go over. When you start getting into moderate and even severe, you may want to use systemic therapies. Systemic therapies could be anything from pills to injections, and they're usually self-injections. And we've had tremendous amount of success, completely changing some of my patients' lives.